Hello, good evening. Welcome back to my Evivences and the European Fertility Society. We are back with one more guest today. Adriana is with us already. Thank you so much, Adriana, for joining us today. I'm really looking forward to our discussion today. How are you feeling? Lovely to have you.
Thank you so much for inviting me. It's very, very nice to be here. And yeah, I'm very looking forward to the webinar at the moment.
Definitely. We are looking forward to it for sure. So before we start, let me just introduce Adriana Meinert. She's the psychologist at the Gynem Fertility Clinic located in Prague, Czech Republic. And today, as you already know, we will talk about how to have a healthy experience of fertility treatment. And of course, Adriana works with patients on daily basis. She helps them, supports them. And we are here to discuss this particular topic today. So of course, she's the best person to discuss this. And she will start with her presentation just to give you some tips on how her work also is done. But afterwards, there will be time for your questions. So I can only encourage you to type the questions in the chat. As always, all is anonymous, and Adriana will be there to simply answer those for you. And as I mentioned, it's all anonymous, so feel free to ask anything that's on your minds. We know it's a delicate subject, so we want to encourage you just to be open, just because we want to simply support you. So simply don't hesitate, as you know, there will be Q&A session right after her presentation. And I think that is it from me. My name is Caroline. I'm your host. So thank you everyone for joining us. Please just let us know that you can hear us loud and clear, just so we can make sure. Thank you so much already for joining us tonight. And I think we can start with our presentation first. And as I mentioned, if you have any questions, you can type them during the presentation or right after it. Okay, ready, Adriana, to start our presentation?
Go ahead.
Brilliant. Thank you so much.
So I hope everyone can see the presentation now. Hello again. My name is Adriana. I will shortly introduce myself, or actually thank you for introducing me, Caroline, already. So I'm a psychologist at the Gynem Fertility Clinic in Prague, and I'm there already for 3.5 years. So at the moment, I'm already quite experienced in being in touch with patients from the first inquiry over the whole treatment until the pregnancy test, and of course, hopefully, always positive pregnancy test, which is the best reward back. And of course, if there is not success, I am there as a psychologist to guide the patients during the whole treatment if they're interested to, at least at like before the treatment or at the peaks of the treatment, which might be the egg retrieval or embryo transfer. So this is what I do at the Gynem Clinic as a very passionate, I guess, psychologist and coordinator. And I'm also a therapist in the course, so being a therapist, so I can do therapies as well in the future. So we will start today the presentation how to have a healthy experience with the fertility treatment, and we will have a look what to concentrate on. Here you can see what you will learn today. It really is concentrating on how patients feel before the treatment and also during the treatment, not really after the treatment. We will get to it a little bit at the end. But this is the I want to focus more on like before and during the treatment, how the patients feel before they even start with anything. Of course, we will have a look on a comprehensive patient-centered care, so you can see what is usually needed and what you can maybe ask for at the clinic. We will focus on patients' needs, which might be divided into behavioral, rational, emotional, and cognitive needs. I will explain this later. And of course, I guess very supportive, the positive outcomes of psychological care in fertility. So how can psychological care help you in the fertility treatment? And at the end, I would like to concentrate on the anxiety management during the 2-week waiting period, which is usually seen like the peak of anxiety for any patient. So we will just get to it as well. As Caroline said, please do feel free to gather some questions, and I will get to them at the end of the presentation. So let's get started. How patients usually feel before the first IVF starts. It can even be IUI, which means insemination, or the IVF, in vitro fertilization, because both means the first artificial treatment on the way to the fertility, which might be hard to go over the natural trying at home with your partner to the artificial support of the clinic. So in general, we can speak about before our, let's say, artificial treatment. So you might be maybe a little bit surprised, but usually patients do not feel more depressed before the start of the treatment than the general population. So if, of course, depression periods occur already before the treatment, it might not be, let's say, the fault of the treatment, because maybe there are some other reasons that the patients feel depressed. But in general, starting IVF doesn't mean that you will fall into depression. This is, I guess, very important to say. Furthermore, there is in patients a moderately increased anxiety than in the general population, but it is actually very logical and natural, because you are going to something artificial you've never done, and it's connected with very big need in your life at the moment. So if there would not be anxiety, it would just show that maybe it's not that important to you. So to feel a little bit increased in anxiety at the beginning of the treatment might be a good signal to take a better care of yourself or to search for help. Next point is that women experience higher social and sexual infertility specific stress than men, which again might end in a higher support, or that the clinics are trying to support more the women than actually the man, which of course ends up that the man feels there is a lack of support for men. But okay, at least we are taking care of the women a little bit more to decrease the social and sexual infertility specific stress. So if you're preparing for the IVF, you can concentrate on this, so you can, let's say, remain your sexual life not only concentrated on the IVF, but still it should remain a little bit naturally. The same for social life with your friends, family, and of course your spouse. What is usually very asked for, that patients are keen to receive some information about psychological care options, which might be offered by the clinics, or maybe by other clinicians in the same city or near your home. Those might be some contact support groups, online support, or any access for to fertility counseling or psychotherapy. So again, if you are asking what can I do before my IVF starts, this is what you can do. You can search for any psychological care options near your home, so you can have at least the contact ready for the moment when you maybe will need it in a later time. So please do mark this as a note, maybe as a small to-do before your IVF starts. What I also want to mention is, of course, that patients feel hope, which is also there, because otherwise they would not be starting the treatment. The hope is very good feeling, and it's a great motivation to go through the treatment and even to start the treatment, because it's a big step. So please feel free to kind of support the feeling of hope and search for relevant information that okay, there is really a success, so we can feel the hope and we can go forward to the fertility treatment. So I will now show you some key principles that might be important for you, especially in the partnership, because each partner can experience IVF a little bit differently, and there can be some conflicts after that. So I really want patients to understand that everyone experiences infertility differently, which is okay. And it can be your partner who is maybe quite fine with it, or maybe it can be your friend who also went through IVF and she was very, very anxious and very, very worried. This doesn't mean that you will be the same anxious and same worried as your friend. It just means that she is experiencing it differently. Of course, everyone experiences emotions, but they might not be visible always, which means that, for example, if a partner doesn't show much emotion, it doesn't mean he is not having them. So this might encourage you to ask your partner for any emotions he might be feeling during the preparation for the IVF. Well, also, this is connected with different levels of resilience and basal trust, which again might end up that some friends of you who experience IVF will have quite a lot of problems with mental health during this treatment, but some of them are perfectly fine and having it like seeing it as a possibility, seeing it as a chance in their life, not as a, let's say, punishment that they are the only one they need to go through this treatment. So again, this different levels of resilience might adjust the point of view I'm looking on the artificial treatment. What is definitely true that everyone needs a different amount of time before moving to the next step. And I mean here even like the next step to start IVF or to start IUI, because somebody just want to go straight forward and not like waste time, but for someone this time is very precious and he needs to think about it. He needs to close one project maybe and then to move forward, like to close the project natural trying at home and then to move forward. It's sometimes they just need more time, so please do respect this and maybe add 1 month if somebody needs it, because usually 1 month is not really changing anything. And also what is definitely true is that everyone needs sleep, food and self-care to function and to make decisions. And in artificial treatment you make many decisions in quite a short period of time. So I would encourage you, if you have the feeling you don't know what to do, how to help yourself or your partner, please do try to sleep well, eat well, and really be very kind to you and your partner. Maybe just say no to some other challenges for a month or two and take care of yourself. This is the point number 6. Be kind to yourself and your partner. And also, of course, everyone is usually afraid to ask for help. It's normal. We are like learned or thought to not ask for help, to make everything on our own. But of course, doing artificial treatment means I'm asking the doctor for help, which is perfectly fine. And this is not, or you are not the only one asking the doctor for help. Our clinic is very overloaded by patients, so this is perfectly fine, and we are very happy to help you in having a baby or having a chance of having a baby. Here you can see the possible impact of infertility on various areas in life, because this is exactly on what you can prepare yourself. If you're maybe thinking, should I go for IVF or what should I do before? This is something you can at least speak with your partner to see what the partner thinks and what is his opinion on things. So you can already prepare a little bit together, and again, not to be alone in the whole process. You're there together, so it's better to discuss it together. The impact of the fertility might be on the partnership, because of course you discuss very intimate themes and areas with fertility specialists, which might be very difficult. There are many hormones, some side effects, and a load of time of waiting, which makes things harder. So it might be challenging for the partnership. Also for family and friends, because sometimes the couple decides not to tell anyone, just under themselves, so the family doesn't know, the friends don't know, and it might be hard to pretend that nothing is going on when you're during the IVF treatment. So it would be quite worth it to think about one or two people around you who might know and who could be your best friends. You can tell, and you can tell how maybe hard it is, or how good it is, how you achieved a lot through the treatment. So I would like to encourage you in this. A very important topic is the finances, because this is of course impacting your wallet or your finances. So please have a look. What would you like to invest, and if you can manage it, because it's better to do it in advance than during the treatment. It might be very stressful then. What is infertility impacting is self-worth as well, and confidence too, because again, if you are not really used to ask for help, and here we're asking for help, and again, maybe women feel that they are not fully women because they can't conceive naturally, or again, men don't feel fully as a man because they can't make the woman pregnant, and this might be impacting the self-confidence a lot. So please do be kind to yourself, and it's not really your fault. That's how it goes. That's what the nature prepared for us as conditions. So it doesn't need to impact the confidence. You're still a wonderful woman and wonderful man if you have any diagnosis. What is important to discuss or have a look to is the career perspective. So there are many ultrasounds usually during the IVF treatment. You need to be off work, and it's beneficial if your boss knows, and if your boss will give you the free time off work. And it might release a lot of stress if the boss knows, because you don't need to take holiday. So you can take sick days, and it's a big relief, because sometimes the boss can be very kind and empathic, but there are also cases that the boss is not willing to let the person leave for the ultrasound or appointment, which might be very, very stressful. Last but not least, there is the point that infertility might impact the developmental stage. This is a little bit of psychological theory, but at the end it says that in each phase of our life there is some developmental stage, and this stage has a goal. It has one goal which kinda should be fulfilled, because if it's not, we feel very anxious and maybe depressive about it, and frustrated that we can't fulfill it. And this is the generativity, which I mean having a child, being a family, or stagnation, which means not having a child, not having a family, and stagnate in the life. So this is of course what makes us feeling such big frustration, because we are not able to fulfill this developmental stage, and it brings a lot of pressure, it brings a lot of frustration, and maybe anxiety and fear with it. So this is good to know. It's not because it's only not possible, but it brings together this, I'm not filling the developmental stage and I really want to. So this is why one might feel a little bit uncomfortable with it. Okay, let's move forward. This topic, comprehensive patient-centered care, I wanted to just schedule you a little bit an overview what you can ask at the fertility clinic, because all those points might help you to go well through the fertility treatment. So first of all, the fertility staff should be trained for emotional support for you. So not only the doctor, not only your coordinator maybe at the clinic, but also the embryologist, the nurse, the receptionist, or anyone else. They should be actually supporting you during the whole process. So it would be, of course, great if everyone would be empathic, or at least smiling and being kind to you. So this is what the clinic should offer. The clinic should offer that both partners are involved. I'm always asking the patients to be both at the clinic if there's a personal consultation or if there's a very important meeting like after egg collection and the sperm sample, so that both partners are involved from the start, from the scratch, and they can make the decisions together. This is very important, and it's giving validation to both partners, and it's not making the self-confidence and self-worth lower. Always, it's very necessary that the doctor asks you for your medical history, women and men, both, because again, the couple is treated, not only the woman. And if this is not done by a doctor, you might at least ask for it because it might be very important for the treatment. The doctor even should not be hurrying you in the consultation, which might sometimes happen because, of course, the doctor doesn't have the whole day for you. But at the end, you might ask that you have 5 questions and the doctor will just need to answer it. So try to ask that you are not hurried in the decisions, at least that you need 1 hour to decide, for example. That's pretty normal and it can support you in making a good decision. Also, you can ask for continuity of the care because, of course, the patients are lacking the continuity of care, especially after the embryo transfer, when they having 14 days of wait and not really much contact with the clinic or the specialist. So you can ask if it's possible to, for example, have a phone call once per those 14 days just to have some continuity, or at least at the end of the 14 days you can speak with the doctor about the result. This is helping a lot. This is connected, of course, with personalized care, which should be automatic. What also helps is offering specialized psychological care, which in our Gynem clinic I offer specialized psychological care, which means I can guide clients through the whole treatment with a few sessions, 4 or 5 at the peaks usually, or before the treatment. So if the clinic does not offer it, you can ask for any psychological care nearby or in your city. What is helping a lot, and patients usually underestimate this, is that written treatment relevant information is better than only said and like vocal information. So you can ask the doctor just to write you some medical reports. It might help you like backwards to see what has been done, and so you can better understand it. You don't need to think about a medication, it's just written on the paper. And again, with the personalized care and not being hurried, it's also connected that you should receive an explanation of results and options you have in the treatment. So it means explanation of what does it mean an unmature egg, what does it mean a mature egg, what does it mean motility and pathology in the semen analysis, and you should be able to ask questions and receive answers. So all those points might support you during the fertility treatment if you receive them at the clinic. Okay, let's move forward. The next topic will be, I guess, the most important and the most handy for you, because you can influence those points a lot and you can concentrate on these points before the treatment starts. I'm dividing the needs before the treatment to 4 points, which are the behavioral needs, what my partner, what the clinic, what the fertility specialist can do. So this is in like doing something. Social needs, which means the relationships, whether it is a marital, sexual relationship, friends, family. So like who is involved around you during the treatment. Emotional needs, which means how will I cope with the emotions and who will support me in my emotions. Of course, connected to the social needs. And the last are cognitive needs, which means how should I cope with my emotions and all the information? So we will, let's say, go through some coping strategies that are relevant and valid, and not, and also some that are not helping at all, so you can avoid them. Let's start with the behavioral needs. Those are some tips for you. I just divided it directly to those person who might help you with the needs. And please think about it. Everyone has individual needs. So those are some tips, what you can ask for, and just you can think about it if this fits for you or not. Okay? So your partner might feel like fulfill your behavior needs, that he'll be there and you can talk to him about your need and your worries or wishes. So what the partner can do, the partner can ask you, what are your needs in the treatment? What are your worries about the treatment? What are your wishes? This is what the partner can stand up, knock you on your shoulder and ask, okay, what do you need? So this is really what you can do. Many partners feel very like they don't know what to do, so this is what you can do. What the clinic can do is that you receive relevant and written information from the clinic, and you gain some time to think about your possibilities and your options, so you can do good decisions. And also the clinic should offer you a postponement of the start of the treatment, because sometimes the patients feel hurried to go into the treatment before they have been thinking about it for a little bit long period of time. So you can just wait 1 month, give yourself a little bit relaxation or time to prepare, and then start the treatment. You can ask your fertility specialist for empathic and personalized treatment options. I mean the doctor in this case. You can, like, what you can do for yourself is to create some time and space for the treatment, which means maybe putting on hold some other projects, but maybe not all of them, because it's good to have some projects ongoing, not only the fertility project, otherwise it's overwhelming. So I mean, like, not doing 10 projects at once, but maybe just 3. So you can have something to do other things, but not that time consuming, because the treatment is time consuming. And what you can also do for yourself is developing a healthy lifestyle. So this also should give you the 1 month before the treatment. You can try to be very healthy, eat very healthy, move a lot, and this all should positively affect reproductive or the general health, and it might be supporting the success. And in your job, you can ask your boss if he can, or you can create a dialogue with your boss about possible absences from work, because they will come, and it's better to ask the boss in advance than first when you need it and he could decline it. So those are the behavioral needs. I will move forward to the social needs. So that means the relationship. What are your needs in all your relationships during the treatment? Well, usually the relationship with your partner at the beginning, it's not worse than in a general population, even you're going through the treatment, because you're in it together, you're deciding all together. So at the beginning, if we still don't know the results, the relationship is quite fine. Of course, if any results are not the best, it can be hard in the relationship for some time. But what is important to say, that women perceive higher, I mentioned this already, social and sexual infertility stress than men, but also, which is positive, women might perceive more intimacy with their partner during the IVF cycle. And not only because they are taking hormones, but also because they feel more connected with the partner. They're like together creating something, creating life, hopefully, which might give them a lot of hope and more intimacy with the partner than in the normal menstrual cycle. On the other hand, men usually perceive less support and higher social isolation than women, because the concentration is more on the women. And this is what you can now know. It's a knowledge, it's a new knowledge for you, and you can do something with it, which means you can, let's say, offer your partner maybe some support in his social net. You can ask you can ask your partner if he has any friend with who he can talk about it, so he has some support. And you can maybe also be intimate with your partner if you feel during the cycle, because this is okay if it's, let's say, if it's with a condom, because during the stimulation it's necessary to be safe, let's say. Well, with the fertility specialist, usually you can ask to involve both partners, because it's important that both partners are involved in the decisions and they know treatment options. So with this, you are creating kind of relationship with your fertility specialist. You're creating trust, which is very necessary during the whole fertility treatment, and it creates compliance with the treatment, that both partners are compliant. Yes, we are willing to do this treatment, and we are going to follow all necessary instructions, medical instructions especially, which is very important. And very important topic, but many couples are being isolated from this, is the social support. And it doesn't need to be the family, it can be just friends, or it can be just friends you don't really know, but they also went through fertility treatment, and this might help you a lot during the whole stimulation until the embryo transfer, to have someone to, write a text message that I'm just after the embryo collection, and I'm very glad that it's behind me, and it has been a stressful time waiting, and so on. So this might help you a lot. I would say the most important are the emotional needs, because of course the treatment is emotionally hard for you, hard time. Of course for the women, because they're under hormones, but of course for the partners too, because they're living with the women under hormones, which might create a hard time. What might help, and this is what also partner underestimate, is it helps a lot if the partner is available and responsive all the time, which means the partner is on the phone, if he is not at the clinic at the moment to make the decisions together, or the partner is available and he's at the clinic with the woman, with the wife, with a girlfriend. And responsive, it means that if there is something to discuss, it will be discussed, or at least it will be said, okay, can we discuss it tomorrow, because today is maybe 10 p.m. in the evening, it's not the best time, let's discuss it during our breakfast. Okay, so the woman just receives the message, he is responsive, we are having conversation about the treatment, and this is helping a lot. Of course, the other way around, the woman should be available and responsive as well. Yeah, if the partner, for example, has some problems in the sample collection room, this might happen. So again, the woman should be available and, let's say, help, or at least support him in this matter. Of course, for example, if the semen analysis is not the best, then it's emotionally very hard for the man. And again, the woman should be there and should be supporting him in this. What also helps is if the couple has similar point of view on the importance of parenthood, because sometimes if one partner is more willing to have a child and the other one is like, well, I don't mind, it's fine, or maybe it's not, so he's not really interested into parenthood, it might create a little bit discrepancy between the partners, which again might not help the compliance with the treatment. So I always say it's better to discuss your view of importance of parenthood so in advance, so you know where you are, let's say. Yes, depression is a big topic, and yes, if you're at risk for clinical depression, you should be referred to a specialized psychological care. There's the question, of course, how do I know that I suffer from clinical depression? But there are many self-assessment questionnaires in the internet, which you might use, or you can ask your fertility specialist or the clinic if they have a screening for clinical depression because, for example, you are not feeling well. I guess in the UK you can ask your GP as well. He should know for sure. It's better to know it because then you can get a proper support or psychological care before it goes deeper, and this might sometimes develop after early loss or after recurrent miscarriages or recurrent negative pregnancy tests. It might be a very tough time, so it's better to ask for support. How the clinic can support you in the emotional needs is to provide you information in advance about the medical procedures, which is connected with the written information to have them in advance. Many clinics have some specialists and coordinators that or who might help you or assist you during the whole treatment, which is wonderful. And I'm so happy for our clinic that we have coordinators because they're with the patients all the time. They're available via email and they can support the patients in any questions. Well, medical, they of course have the connection to the doctors. But usually it's needed to have any connection to the clinic with while having the peaks of the treatment, which is usually oocyte retrieval, which means the egg retrieval, the embryo transfer, that's another peak, and the third peak is the 2-week waiting period before the pregnancy test. Of course, another peak is the pregnancy test. If it's positive, it's quite fine, but still there can be some anxiety. So at those peak times, I would recommend to receive some special care if the clinic offers this. What is really, 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 really helpful if you can express emotions to your important people. So I would definitely support you to have anyone in your surroundings to express your feelings, to say that it's hard, or to say that you are so excited but you can't tell anyone. So this is what is really helping a lot. And it's connected, of course, with openness, which might be hard, but I always say it's better to talk about it at the beginning with the partner as well, just to gain more information about possible childlessness, because at the beginning it seems like this is the end of the world, the totally black hole. But once you gain some information, when you meet some people, they're childless, you might see that it's just a different way of life. It's maybe it's not the wonderful fairy tale life I was dreaming about, but it's also a life, and it's good to see it, to find some new perspectives, maybe already before the treatment, or at least after maybe some, let's say, not successful treatment. It helps for the psych to be a little bit calmer, because then it's not the end of the world, it's just a different way of life. I don't say it isn't hard, but it's just a different way of life. So we will now get to the cognitive needs, which is for you, I guess, also very handy and quite easy to grab on it, let's say. There will be another slides about coping strategies, which might be very interesting for you. And what you can, again, ask your clinic to, let's say, fulfill your cognitive needs is to provide you prepared your information about medical procedures, which means a valid knowledge, which means not a knowledge from any discussion forums. They just do not increase medical knowledge. Okay, I mean, sorry, that internet discussions usually increase anxiety, because the cases that are discussed there are not individual set for you. It's just set for a different woman, and it might maybe create just more anxiety and chaos. So please ask for valid knowledge. And I always recommend here also to ask for cognitive behavioral therapy, because this might help you to cope with your thoughts, cope with your anxiety, and cope with all like these hard times of the treatment. And maybe I can give some examples of thoughts which might be like, I will never have a wonderful life if I'm not having a child, so I must have a child. This is a thought, it's not a truth. So we might then discover it, okay, is it a truth or not, and what facts support it and what facts just don't support it. This might help a lot, and this is how cognitive behavior therapy works, cognitive and behavioral. So let's connect it. We'll look on the coping strategies which might help you. So I would recommend you to avoid the passive coping, which is of course hard to avoid. But if you like, the first thing is you need to be conscious about that you have these thoughts and they're ruminating, which means it's a circle and it's being faster and so on, and that there is some withdrawal from, okay, I don't want to think about it, because this is just creating a higher infertility stress. If there is a rumination, it's good to write it down so you kind of stop the circle. Avoidance coping means that, and this is very often, patients, they avoid being among pregnant women, and generally they are not willing to be around women in general, and also avoiding open discussions with the partner. This is definitely creating higher stress, because if there are no open discussions with the partner can't help you because he doesn't know with what he should help you. So definitely search open discussions, not avoid them. Just create a better atmosphere so you can open the discussion. It's about the atmosphere and about the voice when you say that you want to open discussion with your partner. What you can concentrate on is the active coping, which means goal-oriented problem solving, which means, okay, how we can move forward, which treatment is sufficient for us. It means gaining information, gaining relevant medical information, and thinking rationally about the problem. So it means, okay, which steps we need to do, which tests we might do before we start a treatment. And this is goal-oriented, step-by-step problem solving, which helps a lot. You can make a list with your partner. You can speak with different couples or with other couples. They are going through treatment. You can prepare together, which might support you too. Also, the meaning-based coping is wonderful because it gives the thinking about fertility problems a little bit more positive light, that it's not a punishment, as I've already said, but it's just a different way of achieving a child. And yes, many couples need to do or go this way. And again, I said it already, but I'll say again, find other activities and goals in your life, even for the time period of time in the treatment. Because to concentrate solely on the fertility project, it might, let's say, you might achieve burnout more faster than if there is other activity or goal in your life you can also concentrate to. And this is something what patients underestimate very much, and I really would like to encourage you to concentrate also on different hobbies, on different jobs. Taking some job offers that you always wanted to take it. Okay, take them, because of course if you're pregnant, well, you will stop as every other pregnant woman. It doesn't, let's say, make any difference if you're there just 2 months. Okay, I mean, it might happen. So this is then the employer problem, let's say. So I always encourage patients to do some other things. Okay, so we are getting to the last 2 topics. This might be very interesting for you because it might support you in asking for the psychological support during the treatment. So what are actually the positive outcomes of the psychological care in fertility. Why should I do it? First of all, it supports you, especially the cognitive behavioral therapy. It supports you in higher usage of the active coping and the meaning-based coping. So it means it's a goal-oriented problem solving. It's concentrating on other activities in your life. It's like providing you a point of view more in a positive way to the fertility treatment or maybe childlessness, which helps a lot. It's enabling the use of expressive coping, which means that you share your feelings with other people. Maybe with other women, they went through the fertility treatment, or maybe with your family. But it's very important that you express the feelings when you need it. You just don't hide the feelings in you. Psychological care in fertility supports the partner being available and responsive to each other, because it enables the partner to speak openly about hard themes or hard areas, topics, and it's opening the atmosphere for these topics if it's let's say couple counseling. It also decreased the psychological burden of treatment, because we know that the longer the treatment is, the higher or more burden is there. And of course, it enables an early detection of clinical depression or anxiety, which might like make it even harder for you to go through the fertility treatment. So it's better to at least screen it and heal it or treat it during or before the fertility treatment starts. It's supporting the woman that she will make it through, or the partner if he's suffering under anxiety. So to sum it up, the most important, let's say, points of the psychological care is that it enables to cope with successful treatment, because after that there can be increased anxiety about the pregnancy test. But it can help also if the treatment is not successful, or there has been, unfortunately, an early loss of the fetus or the baby. And it enables the very, very important open discussion about childlessness and the future perspectives with the partner together. So I know it sounds very hard, but it's important to speak about it, and it's important to give the couple a chance to open all these topics if they need it. Okay, and now we will just get to the last topic, which is how to manage the 2-week waiting time for after the embryo transfer for the pregnancy test, which is usually recommended for 2 weeks, 14 days before you do the pregnancy test. Otherwise, you would not have a reliable test because it might be too early. And of course, everyone around you will be saying, yeah, just stay calm and it will be fine. But how am I supposed to do this? It's just too hard to do it, or it seems like this. So let's have a look. I will get you some tips. Because my camera just stopped, so I will just turn it off and turn it on again. So let's move forward. Those are in general recommendations you should receive at your clinic or from your fertility specialist. In general, there is recommended avoiding hot baths, just having a shower, avoiding saunas and swimming pools. Very important, because it's just the heat is not good for the baby or general for the whole pregnancy. Do not lift heavy objects, which means 10 kilos and more. You just like put the belly muscles, they're just too hard, and we just want them a little bit relaxed. So if your partner can help you with all the groceries and luggages, that would be great. I recommend or the doctors recommend avoid jumping or running, but of course you can go the stairs normally. You are not sick, you just need to take care a little bit of yourself. So again, if you are a sporty person and you like exercise a lot, this is fine. You can continue with some exercises more for like pregnancy, first, second trimester. But you should definitely limit cardio exercises because this is exhausting your body, and we need the energy to stay in the body and concentrate on something else than cardio at the moment. So if you can skip it for those 2 weeks, that would be wonderful. The recommendation then, what to do, is include relaxation techniques like walking, pregnancy yoga, and I will show you some other possibilities. Sex is always a big topic, if it's possible or not possible. There are some discrepancies in the opinions of fertility specialists, but usually at least 5 days after the transfer it's recommended not to have any intercourse, just to stay, let's say, sure and safe. But after then, if it's helping you to relax, it's definitely recommended. A balanced diet, I guess this is a classical or automatic thought you should have to eat quite normally and healthy, and to eat familiar foods so you avoid allergies. And I will also show you how to work with your thoughts. Just actively, not deny them, just allow them. That's very best way how to do it. And if there are too many thoughts, which might be by the anxiety, it's better sometimes to distract yourself with other activities for some time. And I also encourage doing the relaxing activities, which might be very easy one, to drink a warm tea or read a book. It doesn't need to be always a guided relaxation, but I will show you some as well. This is what is very important, and I try to say this to all partners, because sometimes you think, well, what should I do in those 2 weeks? Before, I was injecting myself, I was taking all the medication, I was on the egg retrieval, and the sperm was there, so I've done so much, and now what should I do in those 14 days? I can take some supplements, okay, but maybe walk a little bit, but what more? It's important to support yourself consciously, also about other points, which are realizing that the child is wanted. And with this you do so much, because there's such a difference in like implantation of the embryo as well, but especially then in the pregnancy development. If the child is wanted, it's a wonderful condition for the conceivement. If the child is not wanted, it can have some psychological burdens, like further after the pregnancy. So this is wonderful condition already. It's wonderful if you have the support from a loving partner. So let's say if the partner is not really verbal expressive, he can tell you that he supports you and loves you also non-verbally, which means just give a big hug, and it says so much during those 2 weeks of waiting. That you are waiting together, not only the woman is waiting. You can also tell yourself, well, we've been using wonderful and modern technology to help our embryo to grow in the incubator and to be transferred, and maybe to select the best embryo for the transfer, which is wonderful. And of course, remind yourself that you have done so much for the whole treatment or during the whole treatment. And all this should be really supported and accomplished. You can write this down somewhere on a toilet door or somewhere you will see it very well, and you can use it. Those are some topics for guided relaxation. I will not really explain it here because we don't have time for that, but you can search for relaxations for pelvic floor. This might be beneficial for you even before the treatment. If you have the opportunity to see a physiotherapist before the treatment, he might or she might show you some special exercises for pelvic floor. Definitely time outdoors is wonderful because the brain loves the green color of the nature, and it makes you relax immediately. Unconscious. So this is wonderful, and you move outside, you breathe the fresh air. You can try to learn the breathing method, which is you count to 3 if you inhale, and you count to 6 while you exhale, which means the exhale exhalation is double so long, and it decreases the anxiety automatically if you learn it correctly. There is progressive muscle relaxation technique, which is helping with a lot of tension. If the body is in a big tension and you are not really good, let's say, with thoughts, this is a relaxation which helps you over the body, and it's easier. And it might give you a lot of, let's say, contrast between tension and relaxation, and it might help you a lot to understand how the body can relax. And if there are problems with falling asleep, the body scan might help because usually it's a guided relaxation. You can find an audio on YouTube, and it's wonderful to fall asleep. Just find an audio with a nice voice that you like, so you're not nerved by the voice. I will also guide you through now to a small training how to work with like intrusive thoughts, or those like thoughts in circle, because sometimes if there's all the time the thought, okay, I will never have a child, it's useless, it's pointless, it's done, I'm off. So this is of course some carousel which is not helping you at all, and of course the emotionally consequences is usually fear, usually you're very sad, there's sadness, or maybe some anger because of course other women can get pregnant, why can't I get pregnant? So those are normal thoughts coming in. They just might be very hard if they are coming in too much or too often. So I would just recommend to give them 30 minutes. So sit, write some seat yourself and set an alarm for 30 minutes and write down all these emotions and all these thoughts on one paper, and just keep concentrating on those 30 minutes, because usually after writing one page you will be usually quite done, and after writing like 3 times 30 minutes, maybe every day, after 1 week you will be done with all the thoughts and all the emotions, because they will just repeat. And that's the thing that it's important to know what is the point, why am I maybe so anxious, or why these thoughts are just bothering me all the time. It will then just crystal in 1, 2, 3 like most important thoughts. You can then think about it with your partner or speak with some friends, but it might crystallize in something you might not be conscious at the beginning. After the 30 minutes, I usually recommend you to distract yourself and go for a walk or do some another activity. Then it's very good if you can work with those fear thoughts, let's say. So here's an example. After the embryo transfer, every woman might feel a twitched or like some hurtings in the body or in the belly. And it can be like, oh, I twitched, or it hurted something. Maybe I was walking too quickly outside. I hope I didn't hurt the embryo, which is a thought, okay, I just hurt the embryo, oh God, what should I do? But of course, this kind of thinking is not going to help you with the emotional reaction. So I usually recommend to find an alternative thought, that it doesn't matter that it twitched, the little embryo is strong and can endure. And I mean, the embryo has to be strong on it to do the job on its own. You can't really help the embryo to implant. So yes, walking fast actually beautifully stimulates the circulation of blood, which brings all the nutrients in the endometrium and in the uterus needed. And it might slow down a bit, or I might slow down a bit, but I'm glad that I actually walked. So this is how you can work a little bit with the thoughts, because it shows you that not every thought is definitely truthful, and you can trust it. So you can just have a look. Okay, can I have maybe alternative one? It might help. And yeah, we are almost getting to the end. So those are just general recommendations. As I have already mentioned a little bit before, please do avoid discussion forums, because they just exhaust you, they spread misinformation, and they are just not individually set for you. So please do like search for expert articles from the fertility specialists, gynecologists, or your doctors at the clinic. You can try to find the therapy through sharing, because those sharing support groups might be like available online as well, which might be wonderful if you can spend some time with another woman having this treatment. You can search for podcasts. You can create your own journal, like do some journaling every day to clear your mind, to express the emotions. And if you need some more support, you can get psychological counseling and psychotherapy. All this can be short-term or long-term, but both is supportive, and some clinics offer it. For example, I offer it at the Gynem Clinic. Okay, so we are heading to the end, and I also want to encourage you in asking for social and psychological support, because really the research shows that women who receive specialized social and therapeutic, which means psychological support, during infertility, they experience less stress than the women who do not receive any of such support. So again, there is a big encouragement for you to search nearby for such a psychological support. Well, bravo. Thank you very much for all your time, and especially congratulations to you that you've been participating here and during this whole presentation, because this was the first active step for you in caring for your well-being and your mental health. So thank you for your attention, and should you have any questions, we can now get to them. And those are just some information about our Gynem Clinic, which you might be interested to contact us. So I'll just let Caroline take the next step.
Thank you so much, Jenna. It was very interesting. Lots of details you provided, lots of tips, useful, definitely. So thank you so much for this thorough presentation, and thank you everyone for being here as well. I do believe it is already helpful, but of course now we are also here for your questions. There are some questions in the chat. So the first question that we've received is how to notice that I need mental support or therapist during IVF program. Good question. Thank you.
Wonderful question. And well, there are more ways how to see it. Like, first of all, your partner will notice that you are behaving a little bit different, because your partner should be the closest person that knows you. So the partner should be the first one who will say, here's something a little bit different. Don't you want to have some support? Don't you want to talk about it? And the partner should a little bit like monitor how the other person feels. But of course, it's not the whole responsibility of the other partner. Both partner takes the whole responsibility. So it's better, even if I feel kind of weird, I'm not sleeping well, I'm not eating well, or I'm having a lot of panic attacks or anything, or I'm avoiding activities I have normally done. I don't feel any like happiness in the past 1 month from normal things. I was happy about them. This is something which gives you a hint that you might be suffering from, let's say, light depression or light anxiety. And in the internet, there are also self-assessment questionnaires which you might use. I mean, we in the Czech Republic have quite a wonderful web page with self-assessments, questionnaires for mental health. I assume NHS has something as well, so you can have a look what is available in your country, or ask your GP.
Definitely. Thank you for your first question and your help with that. Now I will go to Helen's question. There are a few details here. So basically, she is asking about, specifically, she's asking about the patients who will start the IVF procedure at the late age of 49 plus. That's the information. And she is asking, the question is, can AI-powered mental health apps, there are plenty of those nowadays, such as chatbots, virtual therapists, help tailor psychological support for IVF patients, especially older women in that case? Anything you can advise? Interesting question.
Well, it's interesting because let's say there is a border in the Czech Republic which is different in the age, but it doesn't matter in this point, let's say. Well, in general, the AI can support you in the goal-oriented problem solving because it guides you through, okay, what should I do? Okay, I can do this, 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 this. This is, of course, quite helpful. You don't need to think about it on your own and you just have it in 1 second there listed. But of course, it doesn't give you the human contact. It doesn't give you at all empathic view, any kind views. It doesn't need to be a hack, but at least the empathic dialogue, and a dialogue is important. And the AI gives a dialogue, but you can feel it's a robotic. It's like the perfect answer to your question. And from a person, from a, let's say, human, you will never receive a perfect answer. You will receive just some answer, but it might not be perfect, and which is actually good because it creates some more let's say thoughts, fantasy, and it's creating more thoughts, because that's why the AI seems to be such robotic and emotionally less usually. So
and especially when talking about this particular things, that might be actually, it's good that you have some tips, let's say, but you need to be careful.
It is better than nothing. I mean, if it's 2 a.m. in the morning, it's wonderful, but at the daytime, I would encourage you to search someone nearby in person.
Yeah, and there's another question as well from Helen. So do you think that such AI-powered meditation apps play a larger role in helping women develop resilience throughout the process? This is the exact question. Or maybe it will, it's still changing when it comes to AI, right? So you never know.
Well, I'm not that informed about the English versions of the AI, so I might not be the best person to help here. I just know the Czech apps, and I guess the UK ones might be a little bit more advanced because, I mean, in English you can do more than in Czech, so I can't answer this question.
Sure, that makes sense, of course. Thank you so much. Interesting questions, but sometimes it's just really hard to, answer them, but I hope that helped. All right, next question. So managing physical and emotional fatigue in older IVF patients. So the question is, so IVF procedures can be physically exhausting. Older patients might have additional health issues. What are some effective techniques for managing both physical and emotional fatigue in this kind of age group? This is the question.
Interesting. Well, I would also suggest to the patients to think about it. Okay, what were other stressful moments in your life? Because I assume infertility is not the first stressful situation in your life. Whether it has been studying times, whether it has been searching for jobs, somebody died in your family or friends, or somebody suffers from a very hard diagnosis. So I guess there already has been some such moments, and you can ask yourself, okay, how did I cope with them? What did I did in those times? Okay, maybe I went for cardio and I was jogging 10 kilometers because I just needed to fully express the emotions out like this. So this might help you as well with like the mental burden, especially. With the physical burden, well, you need to balance a little bit that you are going through treatment, so you should not doing the cardio and jogging, but you can do you can put in YouTube like fertility yoga or yoga for kind of first trimester of pregnancy, which might be a little bit contrasting, but it's doing the same. It's relaxing the pelvic floor. And this might be a new habit for you before breakfast. It's better. It will bring you some endorphins, some blood floating. So this might be a good habit. And any new habit brings you, you have the feeling, okay, I'm doing something more. But again, it's maybe good to do 3 new things, not 30, because otherwise you will be overwhelmed.
Sure. Thank you. True. So yeah, focus on that. Hope that helped. Thank you so much. Nicole has another question. So I was advised by my coordinator that acupuncture helps with stress during IVF transfer preparation. Any input on that?
Yes, well, we actually have acupuncturist in our clinic as well, because Gynem Clinic hosts wonderful acupuncturist because he's from America, but he's doing it in Prague.
I think we actually had a webinar with him on acupuncture last year, I think.
Yeah. He's Nathan, his name, but he's very nice.
That's Nathan for sure.
You can watch his webinar, because this might explain your question a little bit deeper than mine. But yes, it's helping to relax. It's again like let's say influencing the waves of energy in the body. It can make the uterus being more blood floated. It can make your pelvic floor more relaxed. So it is usually recommended like on the day of embryo transfer, before the embryo transfer, and after the embryo transfer. This is usually the recommendation of 30 minutes of fertility yoga. They should know the specifics on that. So yes, if you have this possibility and you don't have any fear or phobia from needles, this is a good idea.
Definitely. And I can only encourage you to have a look at our webinars with Gynem. You will find all the previous ones. And there is definitely, I think at least 2 webinars actually. I think so. But of course, I can double check it. So if you can also write to me, I'll be happy to send you a link, direct one. So in the meantime, we did receive a few other questions, and let me just have a look. So there's a message here. So first of all, thank you very much for your wonderful presentation with so many useful details. True.
A
long IVF process, there is more information. So long IVF process is both glorious and devastating. We have been trying for 9 years, sadly with no success. Yes, what is your experience with egg donation? When and how to tell about it to your child? Whom, how, and what to extent, and to what extent, to say about it in your social circle? How to help my child later for the whole, to feel whole, not knowing who the egg donor was. Yeah, anything you can advise? Few questions in one, but it's a tough topic as well. Anything you can advice here?
Well, egg donation is a whole topic for a whole webinar, I must say, but I will try to shorten it. So basically, egg donation is a wonderful chance for people. They, as you say, are trying for 9 years unsuccessfully, or some couples and women just come in the ambulance and they're crying and they're saying, okay, I'm 45, but I just met my best partner just now. It was not possible to meet him before. And I mean, that's how life goes. It's not that straightforward. So egg donation is a wonderful chance for such patients. You will need to think about multiple things. First of all, the legal situation in your country about egg donors, if it's anonymous or if it's not, because Czech Republic has an anonymous egg donation. So you will not know who is the donor, and also the child will not have the chance to know who is the donor if the child receive or achieve 18 years. So then it's the question if we should tell the child if we even don't know who are the parents actually. And again, it's a very hard topic, because you will need to think about the situation in 20-25 years. How about the genetic labs? How about if your child will take the hair of his and you both, and it will just be very clear that you are definitely not the parents. And the child will, of course, be under a shock and will feel no more the trust to you as a parent. So this is the risk you are undergoing when you're going for egg donation and not willing to say. Of course, it's important. I'm saying it very shortly. I'm so sorry, but it's better to that you search more information on the internet about the genetic labs, for example. Sometimes it's good to tell the child from the beginning, like 2-3 years old, to say that, well, the parents, like us, we just needed some help, some medical help, and we were not able to achieve. There are wonderful books about, I'm not aware about the name now, but it's something like the egg donation story, the IVF story, the embryo donation story. And it's like a child book where it explains mom and dad needed some help, so they went to a doctor and they received an egg and such things, which might help the child to understand it from from the scratch. And there are also wonderful books. I guess one is from Denmark with a sperm donor. I don't, I also don't know the name, but if you Google, Emma is the let's say child from the sperm donor, and she's explaining it from the child perspective, which is also wonderful to hear it from the other side. Might help you a lot. And to what extent to tell it in the social circle? Well, it depends how much you, let's say, trust your cycle, your social cycle and family, and what is your relationship and how is the relationship to them, and maybe what opinion they have on general adoption or egg donation. So this might be hard to answer, and sometimes it's better just not to say it if you feel they will be completely against it. And you can, of course, pay attention to the blood groups. So the blood group is compatible, like, let's say, you and your partner will be able to create just few blood groups, depends on which blood group you are. So this also might help if, of course, the donor is the same blood group. It might not create questions too early about why do I have AB if both my parents are zeros, which would not be possible to create. Yeah, okay. So I hope this helps you.
Definitely. And of course, we did a few webinars on this as well. So I'll be happy to share. And there are plenty of books for children. We've seen it as well. I don't have the names, but it's true. It's there out there. So hope that helps. If you would like to get some more information, you can definitely get in touch with us, or I can definitely forward this to Adriana as well and the team. All right, there's a question from Judy. My question is, can my husband and I don't see the age of Judy because the husband is 57, do IVF with your clinic? I know that there's an age limit when it comes to women. There's no age limit when it comes to men in the Czech Republic.
There is a limit to the women, and unfortunately the legal in the Czech Republic is very strict. So according to the law in the Czech Republic, the women can be only 48 years and 364 days. So which means before 49 age. And I mean, after 45, egg donation is recommended, but it's of course individual based.
Yeah, so this is the case in the Czech Republic. So unfortunately, Judy mentioned 57. That's why it's not in this case. The age limit is 49. It's Gynem Clinic. I'm just repeating. Adriana works at Gynem Clinic in Czech Republic, Prague. And I think that is it for today. There's a question about supplements, but I think it's better to ask the doctor, actually, when it comes to any supplements.
Sometimes the doctors are not much patient about the supplements, so just ask in the pharmacy. They will have some more information.
Definitely. Thank you so much. I think that's it for today. As you can see, lots of very nice comments coming up your way, Adriana. I couldn't agree more with them because there's a thanks a lot for this webinar. All the information was very useful. Much appreciated for the wealth of information, investing yourself in helping individuals through their infertility treatment journey. So thank you so much indeed for your comments. I'm really happy to see them. I'm sure Adriana is also happy to see that.
Thank you so much for the feedback. Very appreciated.
Definitely. We will be back. Actually, tomorrow we have another event with Dr. Esther Marban. It will be on IVF failure. So if you have more questions, I can only encourage you to simply sign up and join us tomorrow at 7 p.m. 7 p.m. Sorry. And I hope you will be able to join us and just ask more questions. So yeah, thank you so much, Adriana. Lovely to have you. Thank you so much. And I hope to see you here quite soon as well.
Thank you.
Take care, everyone.
Have a great evening. Good night. Bye-bye.
You too.